Hello, welcome to today's video. In the current context video, we'll talk about what are the side effects of drugs in the human body. Different types of drugs affect the body in different ways, and medications' associated effects may vary from person to person. How one of the effects of the drug to an individual depends on various factors, including body size, general health, the amount and strength of the drug, and whether other drugs are in the system simultaneously. It is important to remember that illegal drugs are not regulated and therefore the quality and strength can vary from batch to batch. Medications can have short-term and long-term effects. These effects can be physical and psychological and can include addiction. You can act differently, feel differently and think differently if you have taken drugs. And you can fight to control your actions and thoughts. You can start using drugs without thinking of any harm to your body. One might think that the drug will not become a problem because you're just a casual user. The more you take a drug, the more you are likely to develop a tolerance to its effects. This can lead to the need to take larger doses to achieve the effects of the drug. For this reason, it seems that after prolonged use, many drugs can cause addiction. Drug addiction can quickly begin to affect your physical and psychological health, and can also affect your work and social life. It is important to remember that there is no safe level of drug use. Be careful when taking any kind of drug. Different drugs have different effects. The drugs affect the central nervous system of your body. They affect the way you think, feel and behave. The three main types are depressants, hallucinogens, and stimulants, depressants. Slow or depress the central nervous system function. They slow down the messages from your brain. Depressants in small quantities can cause a person to feel relaxed and less inhibited. In large quantities, they can cause vomiting, loss of consciousness and death. Depressants affect concentration and coordination and slowing down your ability to respond to situations. It is important not to use heavy machinery while taking depressants. Alcohol, cannabis, GHB, opiates, heroin, morphine, codeine, and benzodiazepines, tranquilizers minors are examples of depressants. Hallucinogens distort your sense of reality. You may see or hear things that are not really there, or see things in a distorted way. Other effects can include emotional and psychological euphoria, clenching jaw, panic, paranoia, stomach upset and nausea. Ketamine, LSD, PCP, magic mushrooms, and marijuana are examples of hallucinogenic substances. Stimulants speed or stimulate the central nervous system. They speed messaging to and from the brain, making you feel more alert and confident. This can lead to increased heart rate, blood pressure and body temperature, decreased appetite, restlessness, and insomnia. In large amounts, stimulants can cause anxiety, panic, seizures, stomach cramps and paranoia. Caffeine, nicotine, amphetamines, speed and ice, cocaine and ecstasy, MDMA are examples of stimulants. Risk factors for drug-related harm. The effects of a drug, and how long they last, depends on a number of factors. 1. The type and strength of the medications you use. 2. How the drug was made. Substances manufactured in home laboratories may contain bacteria, hazardous chemicals, and other hazardous substances, and an unknown force. Even a dose can cause an overdose that leads to brain damage or death. 3. Your physical characteristics, including height, weight, age, body fat, and metabolism. 4. The dose you are taking. 5. Frequency and how long you have used drugs. 6. How you ingest the drug, by inhalation, by injection or orally. Compared to swallow a medicament, inhalation, and by injection are more likely to lead to overdose and dependence. If you inject drugs, sharing injecting equipment will. 6. How you ingest the drug, by inhalation, by injection or orally. Compared to swallow a medicament, inhalation, and by injection are more likely to lead to overdose and dependence. If you inject drugs, sharing injecting equipment increases the risk of contracting serious diseases such as hepatitis and HIV. It will also increase your risk of serious infection. 7. Your mental health, mood and environment, that is, if you are in a happy place or a dangerous secure location, may affect the experience you have when you take drugs. If you have a mental health problem, medication may aggravate or complicate the symptoms of this condition. 8. If you mix drugs, including alcohol. In particular, the consumption of alcohol can lead to high-risk behavior, such as drinking and driving, that can cause death or serious injury to yourself or others. The physical harms of drug use. Drug use can affect the results in the short and long-term health. Some of these health outcomes can be serious and possibly irreversible. Drug use can result in risks or the behavior of the characters. Under the effect of the drug. 1. You are more likely to have an accident at home, in a car, or wherever you are. 2. You can be vulnerable to sexual assault or you can have unprotected sex. Each of these could lead to pregnancy and sexually transmitted infections. 3. You might commit a sexual assault or other violence. 4. You may find it hard to sleep, think, reason, remember and solve problems. 5. Drug use can also lead to results for long-term health include 6. Harm to organs and systems in your body such as the throat, stomach, lungs, liver, pancreas, heart, brain, nervous system. 7. Cancer, such as lung cancer from inhaling drugs. 8. Infectious diseases, common injection equipment and an increased incidence of risky behaviors. 9. Harm your baby if you are pregnant. 10. Acne or skin damage if the drug you are taking causes you take or scratch your skin. 11. Needle marks and collapsed veins, if you inject regularly. 12. Baldness. 13. The growth of male pattern hair in women, such as facial hair. 14. Problems of the jaw and teeth due to clenching and grinding your teeth, or bad breath, teeth, and cavities, gum disease. 15. Mood swings and erratic behavior. 16. Addiction. 17. Psychosis, loss of contact with reality. 18. Accidental overdose. 19. Higher risk of mental illness, depression, suicide, and death. Effects of current medications. Cannabis, hash, pot, dope, weed, grass, skunk, marijuana. 1. Can cause relaxation and altered perception. 2. Can lead to increased heart rate and blood pressure. 3. Can you feel relaxed and happy, but can also cause lethargy, anxiety, paranoia, and psychosis in extreme cases. A story of history or family mental illness may increase the possibility of more extreme psychotic reactions. 4. Is linked to mental health problems such as schizophrenia and, when smoked, lung diseases such as asthma, chronic bronchitis and lung, throat, mouth, and tongue cancer. 5. It affects brain function. Regular use can make it difficult for you to concentrate, learn and retain information. 6. Reduced fertility. 7. When mixed with tobacco, it is likely to increase the risk of heart disease and lung cancer. Cocaine, powder cocaine, coke, blow, Charlie, crack. 1. It gives you more energy. 2. Makes you feel happy, alert, confident and less inhibited, but a bad descends that makes you feel depressed and sick. Depressants drugs with the help of the gravity of come-downs can increase the chances of developing negative cycles of dependency. 3. May overstimulate the heart and nervous system and lead to a crisis, hemorrhage, brain, stroke or heart attack. People died of heart failure induced by cocaine. 4. Reduces your perception of pain and can lead to injury. 5. Carries a greater risk if mixed with alcohol or other stimulants, especially if you have high blood pressure or if you have an existing heart condition. 6. May harm your baby during pregnancy and can cause miscarriage. 7. May increase the risk of mental health problems such as anxiety, paranoia, and psychosis. 8. If snorted, it can cause damage to the lining of the nasal passage and nose. 9. If injected, it can cause increased veins collapse and risk of contracting HIV and hepatitis. Mephedrone, meow meow, cat, plant food, bubble, meth. 1. Can cause feelings of happiness, euphoria, and confidence, but can also cause anxiety and paranoia. 2. causes vomiting, sweating, and headaches in some users. 3. Can overstimulate your heart and nervous system. 4. Periods can cause insomnia. 5. May lead to seizures and agitation and hallucinatory states. 6. If used in large quantities, it can cause tingling of the hands and feet, seizure and respiratory failure. 7. Has been linked to a number of deaths. 8. If injected, can cause veins to collapse and increases the risk of contracting HIV and hepatitis. Ecstasy, MDMA, pills, Rockies. 1. Can you feel alert, friendly and talkative? 2. Can make sounds and colors appear more intense. 3. Can cause anxiety, confusion, paranoia, and even psychosis. 4. Is related, if long-term use, to memory loss, depression and anxiety. 5. Can cause overheating and dehydration. 6. Tends to stop your body to produce enough urine, so that your body retains fluid. Speed, amphetamines, Billy, Whiz. 1. Can you feel alert, confident and energetic? 2. Can reduce appetite. 3. Can make you restless and aggressive. 4. Can cause confusion, paranoia and even psychosis. 5. Can you get very depressed and lethargic for hours or days, when it is used a lot? 6. Can cause high blood pressure and heart attacks. 7. Is riskier if mixed with alcohol, or if you have high blood pressure or heart problems. 8. Put at risk of overdose, vein and tissue damage, and infectious diseases, such as hepatitis C and HIV, if you inject speed. Ice, crystal shabu, crystal, glass, ceramic material, P1. Can create feelings of pleasure and confidence. 2. Can you feel alert and energetic? 3. Can cause you to repeat simple things like itching and scratching. 4. May cause dilation of the pupils or dilated and dry mouth. 5. Can make you cringe. 6. Can cause excessive sweating. 7. May increase your heart rate and breathing. 8. May reduce your appetite. 9. Can increase your libido. 10. Places at risk of infectious diseases such as hepatitis B, hepatitis C, and HIV if you inject. 11. Can damage your nose and cause bleeding nose if you snort it. The effects of a come down. A descends as your body's reaction to the substances you have taken, after the initial reaction. In other words, it is the after effect. How long it lasts, and how it depends on the type of drug, stimulant or depressant, and your age, sex, and tolerance. Common after effects are flatness, depression, and exhaustion. Or you may feel, 1. Shaky, dizzy, sweaty. 2. Headachy. 3. Nauseating. 4. Tired. 5. Not hungry. 6. Sleepy or unable to sleep. Do you like to watch our videos? Please kindly like and subscribe for more related videos.